He's one of literally the last handful of providers in this country, and so women from New York and from Maine and Texas and California, women from big cities with state-of-the-art medical facilities are forced to travel to Wichita, Kansas because it's the only place they can get the medical services that could save their lives and save their health.
This is a huge plan on one side, and on the other side, is illegal anomaly this side. The one on the right, like I said, when it was lasted for about 2 years as a legal care. Autosomal abnormalities make up about 24%.
As you leave the plenary and lunch today, we have packets for you on how you can join this campaign to stand by Dr. Tiller and his courageous staff, and to stand by women in this country and around the world to oppose these kinds of attacks and witch hunts against vital women's reproductive health care.
Have a second?
I have
You're aware of the Infants Born Alive Protection Act that happened in Illinois and at the national level? You know, it was to protect the fetuses that survived, Born Alive Infant Protection Act, when the fetuses survived late-term abortions. And remember, Barack Obama actually voted against that and helped defeat that legislation that prevented the ability to do that in Illinois. And Hillary Clinton was for that Protection Act at the national level. Do you then support Barack Obama because his support of abortion rights goes further than Hillary Clinton's?
I don't think either one of them understood. It's just sloppy technique.
Okay.
It is just technique that is reprehensible. And if there's a fetus that's born alive, the guy that did that ought to have his head beat up.
The doctor?
Yeah.
Okay.
So like when you do abortions, like the babies they're dead before.
Right.
So you don't agree with the right to terminate them after they're
Born. Yeah,
accidentally
so
after abortion?
I just thought that would make Obama more pro-abortion than Hillary.
Well, there's never any reason for that to occur because you often make you make an intrafetal injection of the injection into the baby, into the fetus, into whatever you want to call it. Starting at 18 weeks, there is no viability at 18-week period.
Right.
And I've made that injection since 1983, not because I had to, but because issues of fetal pain.
Yeah.
You know, my experience is that women ascribe to the baby the same fetus, the same level of discomfort, the same level of awareness that they have for themselves. So we make that injection, no fetal pain, no live birth, no prepare your body. I have been talking about that for almost 25, almost 30 years. So it's a technical, it's a question that should not need to be asked. But some people do not make intrafetal injections because I think that they are uncertain. They don't want to see what they're doing, and they're uncertain. Who's the patient? Is the woman the patient or the fetus the patient? If the fetus is the patient, you know, you've got to have all sorts of... If the woman's the patient, she gets a termination of pregnancy up till the day before delivery.
Yeah.
And I have done them at the day before delivery. For women with, the baby's trisomy 18, trisomy 13, going to live for 3 or 4 years as a vegetable. I mean, what's the...
I'm curious though, if I understand that maybe that's not necessary, then why would Obama be against that legislation when all the rest of the Democrats in our country were for it? Why would he be against that bill?
Against?
The Protection Act. Why would he have against that when the other ones didn't? What would be his incentive to do that?
If you had, let's say at 15 or 16 weeks, you had one slip out with a heartbeat.
Yeah.
That is not a viable fetus, but that is born alive to have a heartbeat. Then you have to take that non-viable fetus, rush it directly to the hospital.
Yeah.
Against the woman's wishes.
Oh, okay. So if her wishes are that you don't do that, what would you suggest people do then without this act being in place? Like, what is the...
Well, it's a federal ban now, I think.
Oh, that's right, it did pass.
It was a federal thing. When Obama voted against it, it was something else.
Well, if a baby is born alive, that's sloppy medicine,
Okay.
and shouldn't be done.
Yeah.
I mean, it's just, there's some things that are seasonal and some things are not.
Okay. Who are you supporting for president?
Okay, I'm sorry to
It's the
interrupt.
Democratic.
Okay.
Sorry to
Thank you for
interrupt,
coming to the National Education Association. Appreciate it.